So as a child development service, our core business is supporting the needs of children who have developmental difficulties, and we identify that Indigenous children have a higher risk of having developmental issues. And so although at a clinical level we don't have the services to provide a specialised Indigenous health clinic, and that's not what we're funded to do, we have worked over a number of years at trying to develop our relationships and our links with different Indigenous health services. There's an Indigenous kindy and play group in the community who are kind of well established in that community that we've developed some links with. And that's about, although we can't offer a direct service, trying to develop some relationships to improve access for the Indigenous population to our service. The director was a very strong advocate for actually wanting allied health services to come into the kindy and work with her kids. And so we decided to use a student placement model to see whether we could both address that need, that's something, so in terms of engaging with that kindergarten, that is something that they wanted. So if we can provide something that they want, we can through that start to work on that relationship and also start to capacity build within that kindergarten their ability to identify which children actually have developmental issues, and also how they support those parents to access our service or access other services. We started with some student placements where we had both OTs and speech students who would go into that kindy a morning a week. And through doing a shared placement model with Deadly Years, it meant that the supervision of that was shared. So for my time, it wasn't as much of a demand if I just decided to do that with a student on my own. And over the 3 or 4 years that we've now done that, what the students actually go in and do is quite different now to what it was initially. So what the director wants them to do is different too. So she has started to appreciate, I think, more what OTs and speech pathologists can add to the program, how that can be incorporated as part of the program rather than something different that happens when they come in. And the director and the teacher aides who work in that program have definitely changed in the way that they've been able to identify which children are more needing of assistance than others. So I think that we really have, over that time, been able to develop a really strong relationship and improve that capacity, with that director being able to really strongly advocate with those families to access services that more of them do. Whether they actually end up with us is different, and that's okay. At least those children and families are accessing the support that they need. And then obviously the students, in terms of their learning, they get a whole range of different things. So they're in a kindy environment, so they're seeing the range of normal development down to children who have some quite significant delays. They're being asked to apply their skills in a different way. So it's quite a different experience working with a large group of children to working with one in a clinic setting. And then in terms of the Indigenous health side of it, they're working with Deadly Years on a model of community engagement. So there's a lot that we ask them to do in terms of engaging with the director, finding out what it is that she needs and wants, and checking in with her, and then asking her at the end to sort of evaluate how things have gone and did they provide what she wanted them to provide, and those sorts of things. So there's a lot that they are learning about. Also the fact that this is specific to an Indigenous population, and that there's a whole lot of other cultural information that is really important for them to know about and find out about and think about in terms of their practice. And so that's the whole other side of them looking at whether their practice is culturally appropriate in terms of what they're asking the children to do as well, and making some judgments about how you engage and how you interact in a culturally sensitive way is, I think, there's a whole lot of layers to what they're able to learn and take from that.